Hey, NAMI students, Mr. Yance again. This is Chapter 9 notes. This will be the last one on the skeletal system. We're going to go over mainly joints, which we call articulations of the body. So not just physical structures of joints, but also how they move and that type of thing as well. And we'll kind of use the knee as our representative because it is the most complex of all the joints. So this is part 3. That's why it says part 3, because it is the last of the skeletal system. Okay, so let's start right in with the classification of joints. You'll see here on the screen that a little bit on definition. Technically, a joint is where two bones come together. Doesn't have to move. I think that's the misconception a lot of people have, is that joints have to produce a movement, which most of them do, but not all of them. We'll talk about them in just a second. But it's joints where hold bones firmly together, and sometimes they do permit movement between bones. So we classify joints a couple different ways. That's what's confusing with joints. Let's start with the simple one first. Joints classified by structure, and here's that non-movement thing. So fibrous joints is where, for example, your skull, the parietal, the temporal, the occipital, the frontal, they come together as you're a baby and they fuse, and fibrous tissue grows between the two bones that come together and fixes them in place, so they're not going to ever move. So that is a fibrous joint, no movement. Another great example of that would be in your teeth. That's why I hold your teeth in your maxilla and mandible, so they don't move as well. So fibrous tissue will grow between them. Okay. Cartilaginous is slight movement. Think about your ribs right here where they attach the sternum. That's why it allows us to do CPR. They're not solid bone, they cartilage. They have a little give, not a lot, but a little. Pubic bones also have a little cartilage between them that hold them in place. So the first two are pretty simple, fibrous and cartilaginous. And then the ones that we'll mainly emphasize and talk the most about in this chapter is synovial, your elbow, your shoulder, your knee. Those are membrane-bound joints where two bones come together. There's a membrane lining. There's fluid called synovial fluid. That's where the name comes from. And that allows us freedom of movement in our elbow, shoulder, and places like that. Okay, so those are pretty straightforward, pretty simple, fibrous, cartilaginous, and synovial. And then it gets a little crazier with naming. What about movement? So you'll see that these are the same joints, just a different name. Arthrosis is a fancy Latin word for joint. Sin means without, so without joints or without movement. So those are immovable joints or fibrous joints, one and the same. Ampharthrosis, you guessed it probably. Ampha means slight, so slight movement. And then diarthrosis is freely moving joints like your elbow, shoulder, knee, and those types of things. So those are pretty common classifications of joints, pretty basic stuff. Some crazy naming. We know how that works in anatomy, but that's pretty much what you're going to find in the joint world. Okay? All right, so as I said in the beginning today, here's what we're going to emphasize. I could pick any joint out and kind of go over it in detail, the shoulder, the elbow, the wrist, whatever, but I think we're going to emphasize the knee, and you'll see on the screen the reason for that. Fancy name for the knee joint is tibiofemoral, because the tibia and femur come together and form the joint. Now understand that, I'm going to make this full screen because I'm going to go to some links here. Understand that people don't use that, right? We don't go around and say, oh, I hurt my tibiofemoral. We just call it the knee. But that is a technical name for it because it is where those two bones come together. It is the largest, most complex joint in the human body. That's why we're going to kind of emphasize it, use it as our representative. It's also the most frequently injured. Now, when I say that, you probably would injure other joints more. You're going to jam fingers probably a whole lot more and injure that joint, sprained ankles, things like that. But what that means is most frequently injured that requires a doctor's care, surgery and things like that. So most complex, and that causes us to have some issues with it. The other problem we have with the knee joint is it just lacks a lot of muscle around the joint cavity. As you'll see from this link, You can see there's just nothing on the sides to protect. There's the femur, there's the tibia, nothing on the sides. We do have muscles on the back and some on the front, but the sides are kind of vulnerable, as you can see there from the pictures. So we stop suddenly, we get a blow to the side, something's got to give, and usually those are ligaments that we're going to talk about, okay? So what are some common knee injuries that you might see out there? Tearing knee cartilage. There's two types of cartilage in the knee that we'll talk about. So we'll put 1 and 2 together because meniscus is also a type of cartilage, okay? People can have injuries two different ways. This is a normal meniscus on the right. This is a torn one on the left. I had to have meniscus surgery. I'll show you that video probably tomorrow. But you can see the little difference between them. You should see a little black triangle in here. This one does not have that, okay? And what they do, and we'll talk about these more later, meniscus are like insoles in your shoe. They kind of keep these bones from hitting each other. And then when they get torn, very painful, and we need to go in there and fix that, okay? Housemaid's knee is also called prepapillary bursitis. We have little pads around our knee. There's 13 of them filled with fluid. And when we hit our knee on things, that helps cushion the blow and protects the bones from injury. So you see sometimes people hit their knee real hard and it goes whoop, swells out. It looks really serious. It's not. We had a track runner years ago that hit a hurdle and her knee swelled like 5 times bigger than it just looked awful. Okay. And we thought, oh no, she's got a serious injury. This was on a Monday and she ran in the sectional at the end of the week. So not as bad as they may look. A lot of people have that problem. Okay. And then the one that we worry the most about that's going to require some extensive surgery and rehab, and you hear of football players a lot of times having knee injuries out for the season. That's why is the ACL and PCL, called the anterior and posterior cruciate. They hold the knee firmly together. And you can see them here. That's what they're supposed to look like. Here's a torn one. Same thing here. Look how nice and smooth this is. Not so good here. So pretty common severe injuries in knees is the ACL and the PCL. You can see the difference in those slides as well. And just different pictures. I think this is kind of a fascinating picture. This is our new technology we have. You can see with our collar enhancement technology we have, pretty easy to tell where there's a torn ligament. You can see that one's not looking very good. Hard to see over here, easy to see with this slide. Okay, and understand, to kind of wrap notes up for today, just short notes today, the knee is under 1 ton of pressure just standing. And then we jump and we turn and we move and we run, and then we wonder why we have knee injuries or our knees hurt later in life. That's why. Okay. Okay, so we'll go over this some more tomorrow. I got some videos. I'll see if I can find a way to queue them up on here. And we'll watch some knee surgery videos, and I'll show you how we fix these problems tomorrow. Okay. So pretty short one today. Kind of stay up with notes again like we always do, and we'll probably have a test towards the end of next week. You'll also notice on Google Classroom that I do have a set of terms. We do have a quiz Thursday on Google Forms on those terms. So they're on Quizlet. So make sure you look over those next few days, and we'll take that quiz on Thursday. Okay? Hey, have a good day. We'll see you later. See you. Bye.